Assalamualaikum and greetings to Prof. Zainal and my fellow friends. My name is Nur Syarafana Binti Muhammad Jasmy. My matrix number is BM25110014. Today I will be presenting an overview of cardiology, which is the branch of medicine that studies the heart and the circulatory system. The heart is a vital organ that functions as a continuous pump, ensuring that oxygen and nutrients are delivered to every cell in the body, while metabolic waste products are removed. This process is essential for maintaining cellular metabolism, organ function, and ultimately life itself. Because the heart never truly rests, even minor structural or functional abnormalities can have serious consequences. For this reason, understanding the heart from multiple perspectives is essential, particularly in healthcare and medical sciences. In this presentation, I will begin with the anatomy of the heart, focusing on its structure and organization. I will then move on to physiology, explaining how the heart generates pressure, maintains circulation, and produces rhythmic contraction. Next, I will discuss relatable and common diseases, particularly coronary artery disease and heart attack, which remain leading causes of death worldwide. Following this, I will introduce advanced medical technologies such as angiography and angioplasty that allow effective diagnosis and treatment. Finally, I will conclude the cardiac biochemistry, which explains the molecular and biochemical processes underlying normal heart function and clinical diagnosis. Okay, so from an anatomical perspective, the heart is a hollow muscular organ located in the mediastinum and enclosed by the pericardium, which serve as the outermost protective layer. The pericardium reduces friction during cardiac movement and helps anchor the heart within the thoracic cavity. The heart has distinct anatomical border and is divided into two chambers, the right and left atria and the right and left ventricle. These chambers are separated by the interatrial and interventricular septa, which prevent mixing of oxygenated and deoxygenated blood. A key anatomical feature is the difference in wall thickness, which, as you can see here, the left ventricle has the thickest wall because it must generate high pressure to pump blood throughout the systemic circulation, whereas the right ventricle pumps blood only to the lungs at a lower pressure. So the blood flow within the heart is regulated by valves, which ensure unidirectional flow. These valves are supported by the chorda tendineae and papillary muscle, preventing a valve inversion during ventricular contraction. The heart is connected to a major vessel, including the superior and inferior vena cava, pulmonary trunk, as you can see there, pulmonary trunk, and aorta. Additionally, the heart receives its blood supply from the right and left coronary arteries, while autonomic innervation controls heart rate and contractility. So the heart functions through a highly coordinated process known as the cardiac cycle, which consists of separated phases of contraction and relaxation. These phases ensure efficient filling and ejection of blood. During systole, the ventricles contract to eject blood, while during diastole, they relax to allow filling. So the cardiac cycle is divided into 4 phases. In phase 1, isovolumetric contraction, the intraventricular valves close, causing the ventricular pressure to rise while volume remains constant. When ventricular pressure exceeds aortic pressure, the aortic valve opens. In phase 2, ventricular ejection, blood is expelled into the aorta and pulmonary artery. Near the end of this phase, the ventricles begin to relax and the aortic valve close. In phase 3, isovolumetric relaxation, all valves are closed and ventricular pressure rapidly decreases. Finally, in phase 5, ventricular filling, the mitral valve open, allowing passive filling followed by active filling due to atrial contraction. The heart also maintains two circulation, which is the pulmonary circulation, which oxygenates blood in the lungs, and systemic circulation, which delivers oxygenated blood to tissues. At the cellular level, the cardiac muscle cells generate action potential So the resting membrane potential is approximately negative 90 millivolt, maintained by potassium ions. Rapid depolarization occurs through sodium influx, followed by a prolonged plateau phase caused by calcium entry. This plateau allows sustained contraction and distinguish cardiac muscle from skeletal muscle. Repolarization then restores the resting membrane potential. So, one of the most common cardiovascular disease is the coronary artery disease, which occurs when a major coronary artery becomes narrow or blocked, most commonly due to the atherosclerosis. So this reduces the oxygen delivery to the myocardium, leading to ischemia and potentially irreversible cell death. The severity of coronary artery disease depends on factors such as the size and location of the affected artery. So the degree of occlusion and the presence of collateral circulation. So mid disease may cause chest pain known as angina, especially during exertion. Severe disease can progress to myocardial infarction or heart attacks. So a heart attack occurs when a myocardial perfusion is insufficient to meet metabolic demand, most often due to complete occlusion of a coronary artery. Typical symptoms include prolonged chest pressure or heaviness lasting more than 20 minutes, often described as an elephant sitting on the chest, and may be accompanied by sweating, nausea, or radiating pain to the arm or jaw. This condition commonly affect older adults, particularly individuals with risk factors such as hypertension, diabetes, mellitus, smoking, obesity, and physical activity. So, advances in medical technology have significantly improved the diagnosis and treatment of coronary artery disease. One important diagnostic procedure is coronary angiography, where a long flexible catheter is inserted through the femoral radial or brachial artery and guided to the coronary arteries. A contrast dye is injected to visualize arterial narrowing or blockage. If stenosis is detected, angioplasty can be performed during the same procedure. This involves passing a fine wire across the obstruction, followed by inflation of a small balloon to widen the artery. So, in most cases, a stent, which is a fine wire mesh tube, is placed to keep the artery open and reduce the risk of re-narrowing. Additionally, percutaneous techniques include thrombus aspiration and rotational ablation of hardened plaques. These minimally invasive procedures improve blood flow, reduce symptoms, and decrease mortality. Yeah, okay. So, now I'm going to talk about the biochemistry. So the cardiac biochemistry focus on the molecular and biochemical process that support heart function and signal disease. The heart has an exceptional high energy demand and produces most of its ATP through mitochondrial oxidative phosphorylation, primarily using fatty acids as fuel. However, during stress or ischemia, the heart can switch to glucose, lactate, and ketone bodies, demonstrating metabolic flexibility. In clinical practice, cardiac biomarkers are essential for diagnosis. So cardiac troponins, specifically CTNL and CTNT, are the most sensitive and specific markers of myocardial infarction. CKMB can also indicate myocardial injury but is less specific. In heart failure, BNP and NT-proBNP are released in response to ventricular stretch and correlate with disease severity. Additionally, tight regulation of calcium, sodium, and potassium ions is crucial for normal cardiac electrical activity and contraction. Disruption of this biochemical process can result in arrhythmias, reduced contractility, and heart failure. So, in conclusion, understanding the heart from anatomical, physiological, clinical, technological, and biochemical perspective is essential for appreciating both normal function and disease. So this is my reference link that I use. I think that's all from me. Thank you.